Today we have a call from Indiana, lady with spondylolisthesis with stenosis. She works in a garden center, so she's used to these long and difficult to pronounce words. Spondylolisthesis is a shift in the bones of the spine where one has moved forward compared to another. That's called anterolisthesis. And you see how the spine is a cavity that is maintained by the bones. When the bones shift like this, the cavity shifts like this. It narrows, and that narrowing is called stenosis. Let's talk to the caller and find out how that's affecting her and what her doctor wants to do about it. What's going on?
I'm not. I'm scared. I have my MRI in front of me, and I also have the surgeon's what he wants to do. Which way would you like to do this?
Let's start out with you.
He wants to.
Okay. What made you seek care? What's your life like, and how's this thing affecting you?
Okay, as I said in my first email or message to you, that I've worked at a garden center or in the garden industry for like 30 years. And we just thought I had DDD, degenerative disc.
Right.
And the last couple of years, it's gotten so bad that we finally, or my doctor and I, have finally gotten an MRI and a CT scan. And it showed all kinds of osteoarthritis, stenosis, spondylolisthesis. I didn't say that right.
You're close. Spondylolisthesis, yeah.
I'm saying it backwards.
Yeah.
I also have bursitis in both my hips. And so at work I'd be walking and lifting, twisting, bending, and I could control it with narcotics until I did the slip disc thing. And I was trying to get out of surgery is what I've been trying to do, but I don't think I'm going to be able to do that.
Can I ask you some clarifying questions?
Sure.
Do you live by yourself or with others or with a family?
No, my husband and I. I'm 62.
Okay.
He's 63.
How long you been married?
40-something years.
Oh my gosh.
43, I think it is.
So it seems like
in 1978, so 40. Yeah.
Seems like it's working out, huh?
Yeah, kind of.
Yeah, good for you. Congratulations. Now,
thank you.
Is the pain all in your back, or are you getting pain down your legs like when you walk?
Well, it's really in the bottom of my feet hurt bad, but that could just be from, I don't know, walking too much, breaking my feet down. But if I don't do anything, if I just sit around and walk a little bit, go to the store, come home, but not walk or exercise, go around the block, it's when I sit down, it feels the best.
Okay.
If I walk or try to do PT or my yoga or anything like that, it flares up the sciatic nerve.
And the sciatic nerve.
And I hadn't had that before.
Yeah, and
Pardon?
That by sciatic nerve you mean electrical like pain shooting down the leg.
Yeah, or my buttocks.
And is it the left side, the right side, or both sides?
It's both sides.
It's both sides. Okay. And
yeah, and if I go ahead.
Are you having any trouble controlling your bowels or your bladder? You peeing okay?
No.
Okay.
That's okay.
And not to embarrass you, but no vaginal numbness when you wipe after urination. Everything feels normal.
Yes, it does pretty much, yes.
Okay, good. So no neuro.
Sometimes
Sorry.
the perineum, is that the sometimes I would get a little bit of spasming in there.
Ah, okay.
Okay. But I didn't know if that was from just old age or, whatever.
Yeah.
It's
What were you?
kind of like some things come and go.
Yeah. Yeah. Are you a mom? Did you ever give birth?
Oh, yeah, 2 girls,
Okay.
42 and 38.
Oh, sounds like a lovely family.
Yeah.
2 girls.
My oldest is an RN. So.
Oh, right on. Good for her.
Yeah.
You must have done something right if you got a nurse as a daughter. That's awesome.
Well, yeah, but she was kind of scaring me because she's worked in orthopedics.
Mm-hmm.
And she was scared for me to have back surgery.
Yeah, yeah. That's a common reaction because back surgery is a lot of things, right? There's a lot of
Yes.
range of things that are involved. Now, you've got your MRI report right in front of you, right?
Yes.
Okay, can you read me the impression for the levels that the surgeon wants to do the fusion on?
He wants to do. Wait a minute. There's a lot of paperwork. I don't know how you guys do it.
I know. It's crazy, right?
Okay, here it is. He wants to do a posterior lumbar decompression and fusion from L3 through L5 with transforaminal lumbar interbody fusion L4, L5.
Okay. And do you have the
No, the MRI.
Yeah, on the MRI.
Okay, I have this all setting out really nice so I could keep track of what I was doing. Okay, the impression is 1, degenerative disc and facet. 2, L4 through L5, moderate to severe central canal stenosis due to a combination of spondylolisthesis and severe facet disease. 3, L3 through L4, mild central and mild moderate foraminal stenosis.
Okay. And the surgeon.
And then on the other page from my MRI, it goes down to like L2, L3, L3, L4, L4, L5.
Okay. Okay. Yeah.
Severe bilateral facet disease and.
Yeah. So Dr. Chopra has recommended fusion from L3-4 and L4-5. Is that right?
Correct.
Or was it L4-5, L5-S1?
No. It was
3, 4, and 4,
3
5.
through 5.
3 through 5. Okay.
Mm-hmm.
Now,
and he also said he eventually would want to do 2 to 3.
Interesting.
2 and 3.
Okay. And you had the X-rays as well, right?
Yes, I've had 2 MRIs this year, one in January and one in like August.
Mm-hmm.
And then I had a CT scan in there. I think it was the summer sometime, probably the end of July.
Okay.
But I don't have those impressions, or I don't have that paperwork for those.
Okay. Well, very interesting. So spondylolisthesis is a condition where it's hard to say, isn't it? It's a condition where
that word's gonna kill me.
I know. Well, you work in a garden center. I mean, some of those plant names are harder than spondylolisthesis.
I know, they just roll off my tongue because I've known them for so long, though.
Yeah. In fact, maybe spondylolisthesis could be a new plant name. It would be kind of a prickly plant that causes a lot of pain.
Like the stinging nettle you were talking about the other night, right?
A stinging nettle, exactly. Exactly. Well, I
was going to start on that too, but I thought I'd shut up while I was ahead.
Stop while you're ahead. No, stinging nettle's not going to help with what. So you've got the spondylolisthesis is where one bone has shifted compared to the other bone.
Yes.
And
right.
When that happens, the spinal canal is in the middle, and the shifting of the bones makes the canal become narrow. And that narrowing is what they call stenosis. And there's just
Right.
nothing other than surgery that works for that. And you're having symptoms of that. The sciatica that you're having in both legs, that is due to that
Yes.
severe stenosis. When sciatica is caused
Okay.
by stenosis, it has a special name called claudication, which is neither here nor there, but it
Okay.
sounds like that's what you've got. And, you know, when you start having like maybe some numbness in your private parts and you feel a little funny about what's going on in there, that makes me nervous that
Mhm.
that moderate to severe stenosis is starting to affect those nerves. And once you get too,
That's
yeah, it's true.
yeah.
It
Go
just, it
ahead.
is. Once you get too far down that road, you can't turn back. And so surgery is a good idea. It's been proven to be effective. And the surgery is to
Okay.
decompress the bones and then do a fusion as
Right.
well to put in hardware. Now
Mhm.
some of this is controversial. Some people would say you don't need to do the fusion, only the decompression, depending on how slipped the
Okay.
bones are. I personally,
Right.
I think you know, if you've got a really skilled surgeon, it's it's safer most of the time to go ahead and do the decompression and the fusion, depending on what the degree of the slippage is. So let's assume that you're slipped
Would
enough.
it say?
Yeah, it usually
Where
says
would it say that on my?
so. It usually says grade 1, grade 2, grade 3, or grade 4.
Okay, it says grade 1 anterolisthesis.
Okay, well,
What's antero?
antero means forward.
Eh,
Listhesis means movement.
okay.
Now I'll tell you
All
right
right.
now, there are some surgeons who would not recommend fusion, who would just recommend laminectomy in that situation. And
Okay.
there is a lot of data. There's a lot of information out there that
Mhm.
laminectomy, decompression, and fusion is no better than laminectomy alone in your condition.
Mm. Mhm.
So something to consider. Second thing to consider is Dr. Reddy has recommended fusion at 2 levels, but only one of the levels
Right.
qualifies for fusion. So I'm a little unclear on
That's
why fuse 2 levels.
yeah. See, I was okay when the first time I went to him when he just wanted to do one level,
Yeah.
and I'm like, okay, I didn't like the thought of it, but I'm okay. And then when I go back to him, he says, well, I also want to do 3 and 4 and 4 and 5. And I'm
Hmm.
like, and then he said, and then maybe we'll do 2, 3, 4, and 5. And I'm like, this is getting crazy. Just are you gonna just fuse my whole back?
Well, you know, that's interesting because
And
I looked him up and he's a really good doctor. I mean,
I know
yeah, yeah. I
his
mean, his,
website. I mean, I.
yeah,
Mhm.
well, first of all, he has good training. He went to the University of
Okay.
Chicago for medical school and he did his orthopedic residency there. And then he did a
Right.
fellowship in spinal surgery. So he's a qualified specialist
Mm.
for sure. And his
Yes.
patient reviews on the web are outstanding. He has
Okay.
a lot of reviews, and he averages a perfect 5 out of 5 stars. So he's
I
definitely
know.
this guy's qualified. He's had the right training.
Yes.
He's had the right education,
Okay.
and people love him. So all that is
Mhm.
unquestionable. And then he's also doing robotics, and he's quote unquote minimally invasive. That's how he describes himself. Those to me are more
Well,
examples of quality.
right, and he apologized to me. He said, I can't do the minimally invasive for you
Hmm.
because I think he has to go in too far and make too big of a cut
Hmm.
in my back.
Okay.
Does that
Well,
make sense?
yeah, yeah. I mean, so I would say that Dr. Reddy is a very traditional spine surgeon based on his recommendation. And he has
That's
recommended,
exactly what my doctor said.
yeah,
Yes.
and he's clearly qualified and he's clearly excellent.
Mhm.
And so you've got a really good recommendation. I will say that
Okay.
if you wanted to pursue a less invasive approach, there are surgeons you could see who would recommend laminectomy alone and not recommend
Okay.
all of that. And that is something you could talk to Dr. Reddy about if you wanted. You could say to him,
Right.
hey, what about laminectomy alone? And then what about
Okay.
and it's also appropriate to say, Dr. Reddy, I really was comfortable with 1-level fusion, but not 2-level fusion. And now you're talking about 3. Would you be
Yes.
would you be willing to do 1-level fusion if I understand that, there's a risk that who knows what the future holds, but I'm
Yes.
more interested in less surgery. So if you felt comfortable, you could have
I
that
think
discussion
he's
as well.
Yeah, I think he's worried about the arthritis. He was showing me the CT scan, I guess, and there was all these holes in my bone.
Yeah.
I think that's what I was saying, like lots of little holes everywhere, like
Well,
black spots on the.
yeah, that makes
See, I
sense.
don't have that in front of me. He has that, and he didn't give me a copy of that one.
That makes sense. I mean, I think there's again, you're very blessed to have an excellent doctor. So I think your
Yeah.
choices at this point, you've basically got 2 choices. You need surgery at L4-5.
Okay.
No, I don't think anybody would disagree
Right.
with that. Some doctors would
Yes.
do less surgery, some doctors would do more, and there's nothing wrong with that.
Okay.
That's within the normal spectrum. Um,
Mhm.
it's not so Dr. Reddy believes, and he's clearly qualified and an expert, that you also need
Right.
surgery at L3-4. I think some doctors would not agree with that. So that doesn't mean
Okay.
he's right and they're wrong. It doesn't mean they're wrong and he's right. It means different doctors are entitled to different opinions. In that situation,
Yes.
you have 2 options. You could go get a second opinion from another surgeon, or you could
Mhm.
go to go through with it with Dr. Reddy, or you could talk to Dr. Reddy and say, hey, I don't want to have a 2-level fusion. How about 1-level laminectomy
Yeah.
alone, or maybe 1-level fusion at the most? All 3 of those are legitimate.
Because he knows I'm scared.
Yeah.
I have chronic anxiety anyways.
Yeah.
And
Well, you're entitled to your reaction to surgery.
right.
But I think from my point of view, I feel very comfortable that you definitely need at least that 1 level. You definitely have a great surgeon. So, I mean,
Yes.
to be honest, I don't think you can lose. You're in a good situation.
Okay.
You just have to get yourself
Right.
You got to get yourself comfortable with it. And
That's what everybody says in my own head. I have to get comfortable with this surgery.
yeah, so now
In my head. Yeah.
yes, ma'am, but you're the only person who can answer this question, and that is, in order to get comfortable with it, do you need to get a second opinion?
I think just talking to you and asking about the neurosurgeon compared to the osteo or orthopedic surgeon
Yeah.
and listening to what you've been telling people on your shows has helped me get there.
Oh, good.
And I didn't want the nerves to get so injured or damaged, like I was saying, that it would be too late.
For sure. I think
So,
both kinds of surgeons, neurosurgeons and orthopedic surgeons, are qualified if they have the kind of training that Dr. Reddy does. He's had he's had fellowship training. He's got good ratings. He's experienced.
yeah.
He's clearly
Yes.
in the upper level. So neurosurgeons don't need to do a fellowship because they do more spine training in their residency. It's just a technicality. But either one,
Okay.
you could have a good neurosurgeon and a bad ortho, or you could have a bad ortho and a good, or a good ortho and a bad neurosurgeon. So once they have the right training, it depends more on the person. And clearly your person is
Right.
a good one.
Oh, that makes me feel so much better.
Yeah.
I mean, I trusted what Dr. Mike Gatzimos, he's my internal medicine doctor, and
Yeah.
that's who he's sending me to Reddy.
Right.
I trust him because he knows how I am, and those guys, SBO, do Notre Dame guy. They work on Notre Dame football players and stuff all the time.
That's no
so
joke.
I figured,
Yeah. That's no joke.
Yeah.
Dr. Reddy is in a group with other orthopedic surgeons, and
Right.
that means they think he's excellent. Because if they didn't think he was as good as
right.
them, they'd kick him out of that club, right? So
They'd
that's,
kick him out. Yeah.
they'd kick him out, and they didn't. They love him there. So clearly, that is another
Yes.
sign that you can be comfortable with that this is a good guy in a good group.
Okay.
Yeah.
Yeah, and I think it's time. I don't think we knew exactly what was going on until we started getting the MRIs and the CT scans.
For sure. For
And
sure.
I don't want it to get so bad that it's not fixable or it injures me in some way.
All right, so you're comfortable with Dr. Reddy. You don't feel like you need a second
Yes.
opinion. That's what I'm hearing from you.
No.
Now, last thing.
Not after talking to you.
I honestly, I've never met the man, but from everything I've seen about him online and my understanding, he strikes me as a great doc. Now, my question for you is this one. Would you want to say to him, hey, I really don't want to have 2 levels. I want to have 1 level.
I think what he would say I would eventually need it.
He will. And so now here's the decision you have to make. He will say that.
Uh-huh.
And so you have to
Okay.
say, okay, am I willing to take a chance that I'll have to come back and have the other level? Or
Right.
do I just want to knock both levels out right now? That's the decision you
Right.
have to make now. How do you feel about that?
Well, I just know I can't do this again. If I'm
Then
gonna
you got to
do
have
it,
both levels.
I need to do it all.
Yeah.
Yes.
Then you got to have
Yes.
both levels. Right. Correct.
Okay.
Yeah.
Well, you've made me feel a lot better about this. I don't want to do it. I know it's going to be hard recovering and the whole gamut, but
You're going to be glad you did it. You're going to be glad you did it.
okay.
You don't have a choice, honey. That
Yes.
you're too young. Given the moderate to severe stenosis you have now, stenosis just gets worse as you
Right.
get older. What choice do you have?
Yes.
As you keep getting older, it
I
keeps
don't
getting
have
worse.
any.
You don't have any. So I really, and then
You're right.
yeah, you've got a good surgeon, and you understand your options, and you're making the right decision about how to deal with it. So I mean, if you were you're too young to be. You could be my wife or my sister. You're too young to
Yeah.
be my mom. What I'm trying to say is, if you were in my family, I feel like you've done the right due diligence. You found the right doctor, and you're in good hands, and you should feel comfortable and safe moving
Well,
forward.
I appreciate you so much. Thank you so much.
Oh,
Man, you
no
feel so
problems.
much better.
Hey, will you call me back after
And
and let me know how it
Keep
goes?
doing what you do.
Oh, thank you.
Oh, sure, I will.
Okay.
After surgery?
Yeah.
Yeah.
Yeah, let me know how it goes.
If they can drag me in there. I'm kidding. I'm gonna do it. I will let you know how it goes.
All right, thank you.
I appreciate you, and keep up with your shows and stuff. I think that helps people so much.
Oh, thank you. I
that
really appreciate
They don't
that.
really understand the jargon, the words.
Yeah, yeah.
You
Well,
help people a lot.
Thank you so much. I really appreciate that. You have a good one.
Thank you, Dr. Lieberman.
Uh-huh.
I will call you.
All right,
Bye-bye.
bye. Well, spondylolisthesis with stenosis is one of the most common indications for surgical fusion in the United States, and the operation is done many, many times. It's very difficult for patients when doctors disagree, but it is very natural for those disagreements to happen. There's not one right answer to every problem. It depends on the individual. So we came into a couple of controversies here, which are super important to review. The first one is, should you do a fusion along with a decompression for spondylolisthesis grade 1? And the answer to that question, according to the literature, is small studies have shown no difference between fusion and not fusion. However, the traditional approach has been to do the fusion. So in someone who just wants to have one surgery, be done with it forever, and never go back, the fusion would be the right way to go. For someone who says, no, I want to have as minimally invasive as possible. I don't want them to cut a single muscle fiber of my body that doesn't need to be cut. And if I have to go back later and have another surgery, fine with me. I'll take that chance. That person should have the laminectomy, the decompression alone. In this case, it was clear to me that she wants to have one surgery and one surgery only. So it makes more sense to go ahead and do the fusion. A second thing was how many levels. Well, the MRI clearly indicates that the L4-5 is the level that's the trouble here. But in an excellent surgeon's experience, he's worried about the level above, and he recommended that be included in the fusion. Is he wrong? No. That's his opinion. And does that make more sense for this particular lady? Yes, it does. And so she's going to go ahead and have a 2-level fusion. Now, back when I was a surgeon, I would have recommended just the laminectomy alone and no fusion. Would I have been right? Only time would tell. Would I have been the right surgeon for her? Probably not. She wants to be one and done, and that's what she's going to do. I think she's going to do great. I'm really excited to hear from her back, and we'll all look forward to catching up with her once the surgery is done. For Best Practice, I'm Dr. Dan Lieberman. If you have a question you would like answered on Best Practice Live, there are 3 ways to ask. Leave a comment on any of our social channels, click the link to our website and complete the submission form, or call or text us at 608-602-4022. The more information you can give us, the better we can answer your question. So please contact us and we can walk you through uploading your imaging to a secure server. Please like and subscribe to our channel to stay up to date with information about your spine and joint health. Lastly, be sure to check out new episodes at 10 a.m. Pacific, 1 p.m. Eastern, where we answer all your questions.